New chair. Hopefully it's less squeaky. What's up guys, it's Jen. Welcome back to my channel, Momming with Migraine. There's a hair on my tongue. Yes, I do get migraines, but I also have a condition called pseudotumor cerebri, or IIH, idiopathic intracranial hypertension. It's just fancy words for my brain pressure goes too high, and then also sometimes it leaks out of my nose and then goes too low. The name of the game for me, the way that I live my life and try to mitigate my symptoms, is by keeping that cranial pressure under control. Because if I keep it from going too high, then it is less likely to leak, and then I'm not doing the roller coaster of brain pressures. The roller coaster is exhausting, and it comes with all sorts of crazy symptoms, as you can probably imagine. I've already talked a little bit about the supplements that I take for my pseudotumor, but I haven't told you guys about the prescription yet. I'm talking about Diamox, aka Acetazolamide. Diamox is the prescription that I take to lower my cranial pressure. But what else is it used for? What are the side effects? What do I do to combat those side effects? And what is my dose? Diamox has a habit of coming and going with its effectiveness, so I'll go over things that you should and should not do in order to keep it working. There's actually a lot to it. And I will briefly mention my long-term plan because Diamox is not a medication that usually works long-term. And feel free to share your stories in the comments below. According to WebMD, Diamox works by decreasing the production of fluid inside the eye. It's used to decrease the buildup of fluids in general. It's also been used in combination with other medications to treat certain types of seizures, and it's been used to reduce altitude sickness. I use it to decrease my cranial pressure. Like I said, its effectiveness tends to decrease over time, so it's not a medication that you expect to stay on forever. To me, it seems like it's just a medication that can help you get back on your feet while you work on other symptom management. I'm stuttering a lot today. When it became suspected that I might have pseudotumor cerebri, it was really important to me that I didn't go through a lumbar puncture unless it was absolutely necessary. Why don't I want to do a lumbar puncture? Well, look up post-epidural spinal headaches and look at how bad they can get. That's why I don't want to do it on purpose. Especially because I'm someone who heals slowly, I'm someone with high pressure, so I don't have the most confidence that a hole in my dura would heal very quickly. Diamox was one of the ways that we were able to confirm that pseudotumor is in fact my diagnosis. The road to being diagnosed started before Diamox, of course. I had some blood tests that were consistent. I had some eye tests that were consistent, some papilledema behind my eyes. I have the intermittent leak coming out of my nose that tends to come after these high pressure headaches, so that's consistent as well, plus all of the other symptoms, obviously. Right down to like the positional stuff, the metallic taste, I'll put my pseudotumor symptoms video here. And then Diamox was the icing on the cake, the cherry on top, if you will. Rather than going through a lumbar puncture to see what my opening pressure was, I took a single dose, 250 milligrams of Diamox, and my symptoms went away. People take 500 to 1,000 milligrams of Diamox for altitude sickness, so I started with just 250 and I saw a huge improvement in my brain fog that very same night. Done. Confirmed. No need to be invasive in my spine. The dose that I take now on an ongoing basis is 500 milligrams per day. I take 125 in the morning, 125 at lunchtime, and 250 at night. From my understanding, this is quite a low dose of Diamox. I've heard of people taking up to 4 grams for their pseudotumors. If you're on Diamox, please go ahead and share your dose down below if you're comfortable doing so. And I'm going to go over side effects now, so if you have side effects that you experience with Diamox, please put those in your comments as well. While you're down there, hit subscribe. Thanks. The listed side effects of Diamox happen to be symptoms that I was already suffering with for like 5 years anyway. I'm going to read it instead of pretending to memorize it. Dizziness, lightheadedness, or increased urination may occur, especially during the first few days as your body adjusts to the medication. Blurred vision, dry mouth, drowsiness, loss of appetite, nausea, vomiting, diarrhea, or changes in taste may also occur. I mean, to me that just sounds like having pseudotumor cerebri, and POTS, and migraines. I don't know if you caught that it said dry mouth and increased urination. I definitely have a dry mouth. I'm definitely having increased urination, but I think it's because I'm drinking so much water to deal with this dry mouth, so that's really annoying. Something that I cut out a lot when I'm filming is me re-licking my lips because my mouth just feels so dry. You probably also notice I'm like sipping water all the time. Another weird side effect that's very common is that carbonated drinks just don't taste that good. They don't taste the same. That's not all the time for me. I can sort of intermittently have them, but a lot of the time I'm not that interested in carbonated drinks anymore. That's a small price to pay to have my brain coming back. Just so you know, Diamox can affect your liver and your lungs if you already have chronic disease in those areas. It can also make sunburn more likely. Diamox also reduces the amount of acid that's excreted by your kidneys, so it makes your urine more alkaline and it makes you more acidic. Later on, I'm going to talk about what you can do to counteract that, but one big thing that I do is I take TheraPH. TheraPH is one of those supplements that I told you about that's in my POTS Care Package unboxing video. I will put a link to that video here. That is a gold mine of information. Obviously, I will link it below and I will give you my discount code so you can get 10% off your order of TheraPH. It specifically balances your urine chemistry for while you are on Diamox. More on that later. Then there's this list of tell your doctor right away if these serious side effects occur. And these serious side effects that may occur are literally the bare bones of having pseudotumor cerebri. It's like step 1 of you are an IIH patient. Listen to this. Hearing loss, ringing in the ears, unusual tiredness, easy bleeding or bruising, fast or irregular heartbeat, POTS, muscle cramps or pain, new or worsening eye pain, decrease in vision, mental or mood changes such as confusion or difficulty concentrating, signs of liver disease like nausea and vomiting that won't stop, da-da-da-da-da. The list goes on. The one new thing that happened to me in this category that wasn't just part of my disease already is tingling in the hands and feet. I did have tingling in the hands and feet before, but the tingling that I got from Diamox is completely different and totally crazy. It felt like my feet were in agony. They were burning. This wasn't tingling. This was like pain. The way we got rid of it or alleviated some of that pain was with a heating pad, or for future ones, my husband drew me a foot bath, but like warming up the feet really helped with that burning sensation. That side effect mostly went away within a few weeks of being on the medication, and now it really only returns if I do a bad job taking the medication on time. I do also feel like I'm a little extra tired, but I'm also a month postpartum, so that's probably also why I'm extra tired. I am on the lowest dose that I possibly can be on, basically. I'm on 500 milligrams. I've mostly been seeing people in the 1 gram to 4 gram range for pseudotumor, but again, please do comment your dose down below. I think I'm on a pretty minimal dose compared to other people who have IIH. I like to stay on as low of a dose as possible though, so that I can minimize the effects on my body and try to minimize those side effects as well. My body's going through enough and I just don't want to put it out of whack with big doses of medication if I can help it. I think we all try to avoid huge doses of medication when we can help it. Diamox has this habit of making your electrolytes go all out of whack. So specifically of interest are your potassium levels and your CO2. I was getting weekly electrolyte panels done when I first started the medication so that we could monitor things and make sure that I was adjusting my diet and lifestyle as needed. Something that was kind of interesting is that I actually could feel when my CO2 was dropping too low, because when your carbon dioxide in your blood is too low, the Diamox no longer works effectively. Flary weeks, I would go get my weekly blood work done and my CO2 would be too low. The following week, if I did really well, I was like, I know that this blood test is going to show a good CO2 result. So if you're on Diamox and you notice that it's not working as well and you want to try raising the CO2 in your body, how do you do that? You do it by alkalizing your body. When you're taking Diamox, you want to be careful to be on an alkalizing diet. Alkalinity is the opposite of acidity. So alkalinity will make your body more basic, whereas acidifying makes things more acidic. When you're taking Diamox, your kidneys don't excrete as much acid. So in order to counteract that, you want to alkalize your body and you want to reduce your acidity. Things that alkalize the body. Drink plenty of water, preferably lemon water. Lemons are acidic, but they are alkalizing in the body. Calcium citrate, magnesium citrate, potassium citrate, any of these, but in the citrate form. To keep it simple, I just take TheraPH as I mentioned. Again, my link's down below. You get my discount code too. That's an alkalizing magnesium blend that specifically is supposed to help with your urine chemistry. It was recommended to me that I take it specifically while I'm on Diamox. The hope is that it will decrease my chances of getting kidney stones. Kidney stones, no thank you. I also use Alkazone pH drops. It's called like make your own alkaline water something. I just buy it on Amazon. I'll stick a link to that below. I put like a few drops into my water. I have 4 glasses of that a day. You can also just like eat baking soda, but that was not recommended to me because it has sodium in it and I'm low sodium in general for my vascular health. And finally, there are prescriptions if it comes down to it. Things like Urocit K, which is potassium citrate, if you are really having trouble keeping your alkalinity up. Foods that are naturally a bit more alkaline are things like fruits and veggies, nuts, herbs, herbal teas, seeds, green juice, melons, lemons, and seeds again. The seeds are on the list twice. Those are some of the best alkaline foods. You also want to avoid acidification of the body. So what are some things that acidify you? Coffee, some teas, alcohol, grains for a lot of people, but I usually do pretty well with grains if I pair it with a lot of protein and fat. Certain dairy products, sugary foods, highly processed foods, and extended use of Tylenol can also contribute to acidifying your body. Also though, extended diets that are super low in carb can put you into metabolic acidosis, so you don't want to do that either. The takeaway here is everything in moderation. And listen to your body. There's also an HRV sensor that you get in your POTS Care package if you decide to go that way, and that will let you know how you're doing on your stress levels, which can directly impact how well your body detoxes itself and how acidic you maintain your blood. Did I do good? Let's assume yes and move on. Last thing I meant to mention when I was over there, just in general, alkalizing your body is good, even if you're not on Diamox, even if you're not sick. Holding on to excess acid for a long time can contribute to long-term, like chronic illnesses. It increases your pain and your inflammation, and since it can go undetected for years, you can get some prolonged damage. Sticking to a good diet and keeping yourself relaxed, keeping those stress levels low, are going to be helpful for you regardless of whether you're taking a medication or already sick. Very briefly, future plans. I obviously want to continue to avoid these up and down roller coaster, like high and low pressure things that are going on. But in the long term, the really important thing to me is to preserve as much of my vision as I possibly can and avoid like serious nerve damage or something crazy like that. There are no medications other than Diamox that I can take for this, so after Diamox fails, which it probably will eventually, I'm gonna have to move on to something else. And it's not gonna just be another pill. Some people do repeat lumbar punctures to drain the fluid. It sounds like that's more of a band-aid than a fix, but that can temporarily lower your pressure. But it sounds like more commonly people end up going into surgery. There are shunts, there are stents, there's VP, there's LP. I've seen groin entry stuff, I've seen up the nose things, I've seen that some people end up getting brain surgery. But with most of those, there's also a high rate of revisions and future surgeries. This is again where I'm calling on you to let me know in the comments what the heck you did if Diamox didn't work for you, because that is likely going to be my next step. In an ideal world, I would wean off of Diamox, and the supplements and the other lifestyle changes that I've made will carry me on and it'll all be fine. But I realize that it's unhealthy to like stick to that and really count on it and put my life on it. So I do want to start kind of having my feelers out. I want to start exploring the possibilities and see how they feel and learn how you guys have been responding to those treatments. This is a scary condition to have, and it sounds like it's a long road. I'm doing really well right now, but it's going to be a long road. Hell, it's already been a long road. Anyway, that's everything that I have for you today. Anything at all that you thought of during this video, stick it in the comments below. Don't forget to subscribe. I need to leave. I can hear the baby crying. My mom heart's like, I need to go to the baby. I gotta get going. Thanks for watching, guys. Thank you for contributing with your knowledge and your experiences down below. Check out the affiliate links and all that I'm leaving down below. Check out the discounts that I can give you for POTS Care or POTS Care package, or for the supplements that I take for dealing with Diamox and for my pseudotumor. And POTS, obviously. Guys, POTS is all related to all of this. All right, time to go feed my baby. I love you guys. Bye.